Hi, my name is Becca Blake, a student at Auburn University, and this video is going to be about pernicious anemia. Pernicious anemia, a type of megaloblastic anemia, is a decrease in red blood cells that occurs when the intestines cannot properly absorb vitamin B12, which is necessary for the production of red blood cells. This is due to impaired or decreased production of intrinsic factor, which can be caused by autoimmune disorders, congenital disorders, or surgeries or conditions that disrupt the intestinal lining. Pernicious anemia refers specifically to B12 deficiency caused by lack of intrinsic factor. There are other disorders that interfere with B12 absorption and metabolism, so the practitioner must differentiate between these disorders when making a diagnosis of pernicious anemia. Pernicious anemia most commonly occurs in those aged 40 to 70, unless it's caused by congenital reasons, since there is a hereditary component to the disease. It is also more common in those of Celtic or Scandinavian origin, and there are 10 cases per 100,000 per year. Other diseases that can increase a person's risk of developing pernicious anemia include Addison's disease, thyroid and parathyroid disease, diabetes, and sexual function disorders. There are 3 questions that are essential to ask in the workup of a patient you suspect has pernicious anemia. The first is, have you been experiencing weakness, a sore tongue, or paresthesias? These symptoms make up the classic symptomatic triad of pernicious anemia, and 1, 2, or all 3 of these symptoms are present in 50% or more of cases. The second question would be, have you had a recent intestinal surgery, or do you have an intestinal or autoimmune condition? This will reveal a medical history that is significant and that might indicate a disruption in intrinsic factor production. A last question that you would want to ask would be, have you recently lost weight without trying to? About half of those diagnosed with pernicious anemia report anorexia and a 10 to 15 pound weight loss over the preceding months. During the physical exam, you will want to focus on 3 components. On general inspection, note if the patient has a yellow, waxy pallor, whitening hair, or is flabby. You will also want to look in the patient's mouth and assess the color of their tongue. If the tongue has a beefy red, smooth appearance, this could be indicative of a B12 deficiency. Second, a careful neurologic assessment is indicated. Signs to look for include recent loss of mental capacities, deterioration in hearing and vision, somnolence, depression, and even dementia and psychosis. Most importantly, in the neurologic exam, you will want to assess for paresthesias. Finally, assess the cardiovascular system for tachycardia or murmurs. Before treatment begins, a diagnosis of legitimate B12 deficiency, as well as impaired intrinsic factor production, must be made. If you are unsure if the cause of the patient's symptoms is folic acid deficiency or B12 deficiency, treat the patient with both folic acid and B12 until one or the other is ruled out. There is controversy regarding whether it is necessary to actually determine the cause of the failure to absorb B12. Testing to determine this is expensive, and treatment is the same regardless of the cause of the deficiency. The patient should be treated with B12 for life, and if this therapy is effective, it does confirm the diagnosis of B12 deficiency. Those with B12 deficiency stemming from an underlying disease may need to have additional therapy to correct the deficiency. The patient should receive 1,000 units of B12 as a sub-Q injection for 5 to 6 weeks. He or she can then be given monthly injections of 100 units. Therapy is monitored with reticulocyte counts and hemoglobin levels that should increase. There are 3 teaching components that should be addressed with patients diagnosed with pernicious anemia. First, patients must understand that therapy is lifelong. There must be a relationship between provider and patient so that he or she is encouraged to come in routinely for lab monitoring and medication administration. Second, if the provider deems the patient able, the patient can be taught to self-administer their medication. Teaching regarding how to perform this skill should be conducted. Finally, the patient should be taught to eat a diet high in B12 and to avoid a completely vegetarian diet. Thank you.